Monday Morning House Calls, sponsored by UK Healthcare.
Welcome back to Mountain News. This morning we are joined by Dr. Shoptaw with UK's Gill Heart Institute. Thanks for joining us, Dr. Shoptaw.
Yes, sir. Thank you for having me.
And tell us about what you do. You are a cardiothoracic surgeon, so what all does that involve?
Well, we diagnose and treat cardiovascular, thoracic, and vascular problems. And in this area, there are a lot of risk factors for coronary disease, including high blood pressure, high cholesterol, diabetes, cigarette smoking, obesity, and sedentary lifestyle. So, our first push is to prevent heart disease. And after that, we kind of treat the downstream effects of it.
Okay, and of course you recently moved to Hazard, where you're practicing now, from London. What kind of attracted you to Eastern Kentucky?
The chance to work for the Gill Heart Institute. Dr. Karf, Dr. Swishenberger, Dr. Saha, and Dr. Sakella had contacted me about a potential opportunity here in Hazard. One of the previous surgeons was moving, and they offered me a chance to come here and work.
Okay, tell us about some of the services that you provide, sir.
We perform coronary artery bypass surgery. Of course, a lot of patients will come to the hospital with an acute myocardial event or a heart attack, if you will, and they are taken immediately to the cath lab. And we have a fine group of cardiologists. Dr. Yalamanchi has been here for several years. Dr. Rao, Dr. Serini, and Dr. Bakari call ARH Hazard their home, and they'll meet the patient in the cath lab and then do a diagnostic cath to see if the patient has blockage that can be treated percutaneously with by placing a wire across the blockage, opening up the artery with a balloon or a stent to preserve the heart muscle. And we back up those cases. Some of those cases will need urgent surgery, but for the most part, they treat those patients within about 90 minutes of coming to the hospital. They're in the cath lab, they have a wire across the blockage, they blow up a balloon and deploy a stent to kind of correct the damage that the heart attack is doing.
And of course, beyond heart attacks, what other kinds of cardiovascular problems do you see in your practice?
Well, anybody that has blockage in their neck arteries or carotid arteries is at risk for a stroke, or now a common term is a brain attack, if you will, just to let the people know that there's urgency involved in the treatment for a time when they're not getting enough blood to their brain.
And of course, if something like that were to happen, what kind of symptoms do people need to look for?
Generally speaking, for a stroke or for a brain attack, if you will, they talk about the face, arm, leg, and speech. So if you have an asymmetry of your face, weakness or numbness of your arm or leg, and difficulty with speech. Some patients, however, would have like a headache or other kind of vague symptoms, or simply passing out and being found unresponsive.
And of course, that's the kind of thing you're going to need to get to a hospital, talk to a specialist, right?
Oh yeah, we would implore people to call 911 and to get the ambulance to come pick them up and take them to the hospital so that they can institute treatment right away. If you're having a stroke, they would maybe give you an aspirin on the way to the hospital. If you're having a heart attack, a lot of times they can send the EKG to the emergency room and summon the cath lab staff in before you're at the hospital.
All right, Dr. Shoptaw, thanks for joining us, and Mountain News This Morning continues in just a moment.